Ever since I was diagnosed with early stage breast cancer many years ago, I have felt very fortunate that I've had a breast cancer team that I can communicate with. I can ask questions, I can question decisions, I can get second opinions. I'm wondering what advice you would give to other people in my position if they don't have that type of communication with their oncology team.
Mm-hmm. This is an important issue that is emerging recently because of the specialty testing that's happening in cancer. 20, 30 years ago, an oncologist could be a generalist. They could treat lung cancer, they could treat leukemias, they could treat breast cancer. Breast cancer, though, has evolved a lot over these last couple of decades. And so it is very difficult today for a general oncologist to understand every minutia and nuance of these sorts of tests. So my recommendation is, if you're at a large academic medical center, you generally are seeing someone already who's specialized in breast cancer. Mm-hmm. If you happen to be in an area where you have a community oncologist who's treating other cancers, who may likely be an excellent oncologist, it's still important to try to get an opinion, at least one opinion, from an academic medical center. Mm-hmm. And generally, there's a collegiality between the oncologists. So the academic oncologist will communicate with your oncologist and give their recommendations. And you'll often see that then you'll still get the types of testing and the treatment that is generally the most up-to-date and the most cutting edge, even at your local community site. So if you're a patient with metastatic breast cancer, it is important to talk with your doctor about this kind of testing. You may not even realize that you've had it done. As I mentioned, sometimes the testing is done on a tissue sample. So a biopsy is done, and all you may know is that you're estrogen receptor positive, HER2 positive. You may not realize that additional testing has been done. So having that direct line of communication and dialogue with your team, whether it's your oncologist, a nurse practitioner that you may see in the middle, even the nurses, they all may be aware that you've had this kind of testing. And as you're getting treated over the months and years that you are getting various types of treatment, if the cancer is progressing, again, have that conversation. Should I get this testing? Should I get a biopsy? Should I get a liquid test instead? Can I get it? Is it available to me? Is it something that'll be covered by my insurance? So continue to have these conversations with your team, because it's not only about the standard therapies that are available to you from the oncologist, but also for clinical trials. So whether it's in a community setting or in an academic setting, often there are clinical trials available. And unlike clinical trials of old, which all we did is look at breast cancer in general and then try different treatments, the trials that you'll see today are often specifically targeted at certain mutations. So it could potentially make you eligible for a novel therapy, which may be, depending on the results of that trial, which may be even more effective than what you're getting.